Hi, my name is Olivia Marino, and I'm an aesthetic nurse practitioner at Ponsky Facial Plastic Surgery. Welcome to our guide on preparing for and recovering from surgery. We understand this process can feel overwhelming, but with proper care and preparation, your experience can be smooth and stress-free. Let's walk you through the first key steps. 1 month before your surgery is a perfect time to get organized and start preparing for a smooth recovery. Let's go over what you need to do. First, if your surgeon requires pre-surgical tests such as a physical exam, lab work, or an EKG, schedule them now. Avoid waiting until last minute to ensure everything is completed on time. Focus on your health. Eating a balanced diet and staying active will prepare your body for a quicker recovery. Every healthy choice you make now supports your healing journey later. Take care of personal grooming, like a haircut or hair color appointment well in advance. This way, it's off your to-do list before surgery day. If you're preparing for a chemical peel or laser resurfacing, one of the most important steps is to avoid tanning. This includes natural sunlight, tanning beds, and self-tanning products. Ensure the treatment area is free of any tan to maximize effectiveness of your procedure. Avoid sun exposure to the treatment area both before and after your procedure. Protect your skin by using sunscreen with SPF 30 or higher daily for at least 1 month leading up to your treatment. Continue protecting the treatment area after your procedure by wearing a wide brim hat and reapplying sunscreen frequently. Avoid prolonged sun exposure to ensure proper healing and preventing complications. By completing these steps a month before your surgery, you're setting yourself up for success. Remember, preparation is key to a smooth and stress-free recovery. 2 weeks before your surgery, it's time to make critical adjustments for your health. Start by avoiding all nicotine products, including cigarettes, vapes, chewing tobacco, and even nicotine patches. Nicotine can reduce blood circulation, slow healing, and increase the risk of complications. Next, arrange transportation. You'll need a trusted family member or friend to drive you to and from the surgery center. Make these plans now to reduce stress later. Prepare a recovery area in your home. Choose a comfortable, easily accessible spot and stock it with essentials like pillows, loose clothing, healthy snacks, water, and medical supplies. To prepare your skin for a chemical peel or laser resurfacing, start using tretinoin and hydroquinone 2 to 3 weeks before your procedure. This combination will help you optimize your results. After cleansing and drying your face, apply a thin layer of tretinoin to the entire face. Follow this with a thin layer of hydroquinone. If you are treating your neck or chest, use these creams sparingly, just 2 or 3 times a week. This prevents excessive irritation to these more sensitive areas. By completing these steps 2 weeks before surgery, you're ensuring a safer, more comfortable recovery. Small preparations now make a big difference later. As you prepare for surgery, it's crucial to review your medications and supplements with your healthcare provider. Stopping certain medications and supplements before surgery reduces your risk of complications. 2 weeks before surgery, stop taking NSAID pain relievers like aspirin, Advil, Aleve, Motrin, Bayer, and Excedrin. These medications can increase the risk of bleeding. Additionally, discontinue diet pills and weight loss injections such as Wegovy, Ozempic, and Saxenda. These can interfere with blood clotting and anesthesia. Common prescriptions like Coumadin, Eliquis, and methotrexate also need to be stopped. Consult your prescribing physician to ensure it's safe to pause these medications. Certain supplements like fish oil, ginseng, turmeric, and vitamin E must also be avoided. These can impact your body's ability to heal. To support proper circulation and healing, avoid smoking 6 weeks before and after surgery. If you're taking antibiotics, remember these can reduce the effectiveness of oral contraceptives. Use an alternative form of contraception during this time. If you have any questions or concerns about stopping a specific medication, consult your prescribing physician or contact our office immediately. We're here to help. 3 days before surgery, begin taking Arnica montana, a homeopathic agent that helps reduce bruising, swelling, and bleeding. Take 2 tablets 3 times a day. On the day of surgery, stop taking Arnica and then resume taking 2 tablets 3 times a day, starting the day after surgery. Continue until the box is empty. If you're preparing for a chemical peel or laser resurfacing, stop using tretinoin 3 days before your procedure. This prevents unnecessary irritation and ensures your skin is ready for treatment. The night before your surgery, it's crucial to follow these instructions carefully. Do not eat or drink anything after midnight. This includes water, coffee, gums, or mints. Failure to follow these rules may result in your surgery being canceled or delayed. Additionally, avoid alcohol after 6 p.m. the night before surgery. This ensures your body is in the best condition for your procedure. If you're preparing for a chemical peel or laser resurfacing, Discontinue the use of hydroquinone 1 day before your procedure to avoid irritation. By following these instructions, you're helping ensure your procedure goes as planned. The day of your surgery has arrived, and we're here to guide you through every step. Start by bringing your photo ID and insurance card. These will be required for check-in at the surgery center. Remove all jewelry before leaving home and avoid bringing any valuables with you. Wear glasses instead of contact lenses if needed, and choose loose, comfortable clothing. A button-up or zip-up shirt is ideal for easy changing. Take a shower or bath before arriving, but avoid using lotions, oils, or perfumes on the area where surgery will be performed. When you arrive, the surgical team will greet you at Brainerd Surgery Center. This fully accredited facility is designed for your safety and comfort. You'll be escorted to the preoperative area where you'll change into a gown and socks. This is your opportunity to meet with Dr. Ponsky and the anesthesiologist to review final details and ask any last-minute questions. To help ease your anxiety, you'll receive medication before entering the operating room. Before you know it, your procedure will be complete. After surgery, you'll be moved to the recovery room where you'll be closely monitored by a highly trained registered nurse. Most patients wake up fully within 30 to 60 minutes, although it's common not to remember much of this time. Remember to arrange for someone to drive you home and stay with you overnight. For your safety, public transportation, including taxis and ride shares, is not allowed. Your comfort and safety are our priority. If you have any questions about your surgery day, do not hesitate to ask us. On the day of your surgery, you may feel drowsy and unsteady as the anesthesia wears off. This is completely normal. To manage any discomfort, take your prescribed pain medication or extra-strength Tylenol as directed by your doctor. This is when you'll need it the most. Recovery takes time, and following these simple steps will ensure a smoother healing process. Take it easy and focus on rest. During the first week after surgery, you may notice swelling and bruising, which is completely normal. Swelling and bruising often peaks around day 2 and 3, but should start improving by the end of the week. Remember, one side of your face may be more swollen than the other. This is common and temporary. Dizziness and mild discomfort are also common during the first few days. Stay hydrated and manage any pain with your prescribed medication or Tylenol as directed. Short episodes of sharp pain or itching are part of the healing process as well. It's not unusual to experience mild depression during this time. Swelling and bruising may temporarily alter your appearance, making you feel a bit down. Remember, this is a normal part of recovery, and you will improve each day as the healing process progresses. The first week of recovery can feel challenging, but each day brings you closer to your desired results. Be patient with yourself and remember that healing is a process. If you have any questions or concerns during this time, don't hesitate to reach out to our team. We're here to support you with every step of the way. Every surgery is unique, and so is the recovery process. In this guide, we'll walk you through what to expect and how to care for yourself after specific procedures to ensure a smooth and successful recovery. It's normal for your neck and face to feel tight after surgery. This tightness will gradually improve over the next few weeks to months as you heal. After a chemical peel or laser treatment, keep your hair away from your face and neck using soft hair bands. Ensure your recovery space is clean, dark, and comfortable. Wash your linens beforehand to minimize infection risk and keep pets away from treated areas. The treated area will look like a deep sunburn, and you may experience itching within 1 to 2 days. Skin weeping for 3 to 4 days is also normal. To manage itching, take antihistamines like Benadryl, Zyrtec, or Claritin. Use hydrocortisone cream as prescribed. As your skin heals, bright red or pink coloration will fade, but some pinkness may remain for 6 to 12 weeks or longer. Small bumps or pimples may appear as your skin heals. Avoid picking at them to prevent irritation or scarring. They'll typically clear within 1 to 2 weeks. Understanding what to expect for your specific procedure can make your recovery smoother and more comfortable. If you have any questions or concerns, our team is here to support you every step of the way. Daily care after surgery is essential to promote healing and ensure the best possible results. In this guide, we'll walk you through general post-operative care and specific instructions for your procedure removal. Sleeping in the correct position is essential to your recovery. Let's review the recommended sleeping guidelines for the first few weeks after surgery. For the first week after surgery, sleep on your back with your head raised about 30 to 40 degrees using 2 pillows. This will help reduce swelling and bruising. If you usually sleep on your side, try sleeping in a recliner if you have one. Alternatively, you can use an airplane pillow to keep your neck straight and prevent rolling while you sleep. If you've had a neck lift, mini lift, mid-face lift, or brow lift, continue sleeping on your back for an additional week after the first week of recovery. This helps protect the surgical areas and ensure optimal healing. After rhinoplasty, continue sleeping on your back for an additional week following the first week of recovery. Elevation and positioning helps reduce nasal swelling and ensures proper healing. After surgery, wearing glasses and contacts may vary depending on your procedure. Let's review the specific guidelines to ensure your comfort and safety during recovery. For most procedures, you may wear your glasses as usual after surgery. Contact lenses can typically be inserted once the majority of the swelling has subsided, which is usually around day 4 to 6 after surgery. For chemical peels or laser treatments, during the first week, glasses can be worn briefly, but avoid wearing them for long periods of time to prevent pressure on the treated area. After 10 days, glasses can be worn normally if the area around the eyes or face was treated. Icing after surgery is an important step in reducing swelling and bruising. Let's review proper technique and specific instructions for your recovery. During the first 48 hours after surgery, apply ice to the surgical area for 10 to 20 minutes every hour. You can use an ice pack, ice gauze, or sandwich bags filled with frozen peas. After 48 hours, ice may no longer reduce bruising, but can still be used for comfort if needed. Use as often as it feels helpful for soothing the area. Proper showering and face cleansing after surgery is essential for maintaining hygiene and supporting your recovery. Let's walk through specific guidelines based on your surgery. For most procedures, you may wash your hair and face the day after surgery. Use a gentle soap or cleanser for your face. Proper care for your skin after chemical peel or laser treatments is essential for optimal healing. Let's guide you through the daily cleansing and showering routine step by step. During the first 24 hours after your treatment, keep the treated area moist by applying Aquaphor or Eucerin as needed. Do not let the skin become dry or feel tight, as this may hinder the healing process. The day after your procedure, use warm water and your fingertips to gently remove most of the Aquaphor or Eucerin. Wash your face with baby shampoo in the morning and evening, and then pat it dry with a clean towel. After cleansing, reapply the Aquaphor or Eucerin and cover the treated area with the provided plastic sheet mask. Throughout the day, use clean fingers to remove and reapply Aquaphor or Eucerin 3 to 4 times a day. Always reapply the plastic mask after each application. The plastic mask should be worn continuously for the first 2 to 3 days. 2 days after surgery, if you've had a deep chemical peel or CO2 laser treatment, begin vinegar washes twice daily. After washing your face with baby shampoo, pat your skin dry. Soak a cotton ball or cotton round in the provided vinegar solution and gently dab or pat the treated area. Reapply Aquaphor or Eucerin in the plastic mask after each vinegar wash. You can wash your hair 2 days after surgery using the provided baby shampoo. If cleansing your face in the shower, gently splash warm water over your face instead of scrubbing. After surgery, it's essential to avoid certain medications and substances to ensure proper healing and avoid complications. Let's go over these restrictions. First, do not drink alcohol while taking pain medication. Mixing alcohol with these medications can increase side effects and delay your recovery. Avoid taking medications listed in the medications to avoid section, including aspirin, Excedrin, ibuprofen, and other NSAIDs like Advil, Motrin, and Aleve for 1 week after surgery. For any aches and pains, acetaminophen, such as extra strength Tylenol, is a safe alternative. Use it as directed by your doctor to manage discomfort. After surgery, movement plays an important role in your recovery. Spend as much time as possible in an upright position and walk around your house regularly. This helps promote circulation and healing. However, avoid bending over and lifting heavy objects for at least 1 week. This reduces strain on your body and supports proper healing. For 2 weeks, avoid strenuous exercise and sexual activity to prevent unnecessary strain or complications. Minimize talking, laughing, and chewing during the early recovery period. These activities can increase swelling and discomfort. Your diet plays a significant role in your recovery after surgery. Let's review specific food restrictions and dietary recommendations for your procedure to ensure optimal healing and comfort. After surgery, sticking to soft foods for the first week can help reduce pain and swelling. Soft, easy-to-eat options are gentle on your body as it heals. Good choices include Jell-O, pudding, mashed potatoes, and other soft, easily digestible foods. Always eat something before taking medication to avoid an upset stomach. Even a small portion can help keep you comfortable. Remember, your body needs gentle nourishment to recover. Avoid hard or crunchy foods that may increase discomfort or swelling during the first week. Taking care of your diet after surgery is a simple yet important way of supporting your recovery. choosing soft foods, eat regularly, and give your body the care it needs to heal. After surgery, it's essential to follow specific guidelines for makeup, hair care, and facial treatments to ensure proper healing and reduce the risk of complications. Let's review the recommendations for each procedure. For most procedures, avoid wearing makeup for the first 2 days after surgery. Avoid tweezing your eyebrows for at least 10 days. You can use makeup to camouflage bruising before your suture removal visit, but avoid applying it directly over incisions for 10 days. After a chemical peel or laser treatment, do not apply makeup until your doctor gives you approval, typically after about 10 days. If you've had a full face treatment, wait 3 weeks before coloring your hair. Avoid waxing or tweezing facial hair in the treated area for 6 weeks. Never pick at crusts or peeling skin. Let them fall off naturally to avoid scarring. For these procedures, avoid applying hair color for 4 weeks after surgery. Do not tweeze your eyebrows for 2 weeks. Avoid makeup for the first 4 days and never apply it directly over the incisions for at least 10 days. Resuming normal activities after surgery requires careful planning to ensure a smooth recovery. Let's go over activity guidelines specific to your procedure to help you recover safely and confidently. For all procedures, do not drive while taking pain or sleeping medications, as these can impair your ability to operate a vehicle safely. Wait until you are completely off of these medications before resuming driving. Protecting your skin from the sun is an essential part of the recovery process after surgery. Let's go over the specific sun protection guidelines for your procedure to ensure proper healing and prevent complications. For most procedures, avoid direct sun exposure to your face for 1 month. If you must be outdoors, always wear SPF 30 or higher, sunglasses, and a wide brim hat to shield your skin. For chemical peels or laser treatments, extra precautions are required. Avoid direct sun exposure for at least 3 months to prevent darkening of the skin. Begin using sunscreen 10 days after your procedure. Choose a broad spectrum sunscreen with SPF 30 or higher. Apply sunscreen to the treated area 1 hour before sun exposure and reapply every 3 hours while outside. Avoid prolonged outdoor activities such as sunbathing or sports during peak sunny hours. Continue protecting the treatment area from the sun for 3 to 6 months to ensure proper healing and preventing pigmentation or scarring. Monitoring your recovery and knowing when to report symptoms is crucial after your procedure. Let's review specific signs to watch for and when to contact your surgeon. If you experience excessive bleeding that continues after pressure for at least 20 minutes, contact our office immediately. Watch for signs of infection such as excessive swelling, redness, sudden increase in pain, unusual drainage, or a fever above 100.3 degrees. These symptoms should be reported right away. If you notice any signs of a drug reaction such as rash, hives, or itching, contact our office immediately to discuss next steps. Your safety is our priority. If you notice any of these symptoms, don't hesitate to reach out. Early reporting ensures prompt care and peace of mind. If you're prone to fever, blisters, or cold sores, these may occasionally flare up after a chemical peel or laser treatment. If this happens, call our office immediately. We can prescribe treatment to manage the outbreak and help protect your healing skin.